My name is George Dmyterko. Like most people, once I reached retirement age, I had a choice between just straight Medicare or a substitute for Medicare. I went for a substitute. Just not too long ago, the doctor sent me in to get what's called a fine needle aspiration. Basically, that's just a biopsy thing. Once the hospital checked me in, they told me that my portion of the payment would be $285. Now, $285 for a lot of folks is not a lot of money, but frankly, that blows my monthly budget. And even more, I was surprised. I knew that if I had a diagnostic test, my copay was supposed to be zero, and $285 is nowhere near that. I called my insurance company. I told them my opinion is that this fine needle aspiration is simply the same thing that the blood tests are. In both cases, they're doing it for the same reason, to help the doctor make a diagnosis. And they should be reimbursing me the $285 for that. The person I talked to told me no, that this was a outpatient procedure, not a diagnostic test, and that was that. Another doctor sent me to get a PET scan, and Parkview Hospital told me my portion would be $2,400. I called my insurance company, and this time the gentleman I was talking to agreed with me. He says, yeah, that's a diagnostic test, don't worry about it. I ran the PET scan by them again. I didn't want another surprise. And the story was different. They're succeeding pretty well at keeping me confused. The figure they came up with was my portion would be $1,400. I simply canceled everything because $1,400 or $2,400 is simply out of my reach.